Hello, my name is Brian Lee, CEO of Custom Learning, and welcome to the Reignite Winback initiative. What we're going to talk about today is how to reignite caregiver engagement to win back every single patient. I want to begin with a story about a book called Nuts. It's really the story about Herb Kelleher, the founder of Southwest Airlines. It's a remarkable journey. And in the book, one of the pilots tells a story about how they calculated that every flight Southwest Airlines runs produces $360 profit, which is the result of the last 6 passengers that get on board. They make $60 each. And the pilot pointed out that if they weren't as good at customer service, if their on-time arrival wasn't as good, if their nuts weren't as tasty, if they didn't execute well, what if only 3 of those customers got on board? Then their share value would be dramatically lower. What if the 6 didn't get on board, they didn't make money, and they were breaking even? Well, they wouldn't be in business. Well, that question, that example is really a great metaphor of what's happening in healthcare today. Question, what happens to the financial viability of our hospitals and clinics and healthcare agencies if their volumes peak at 85 or 90% of previous volumes? Well, prior to the pandemic, our mission at Custom Learning was to ignite caregiver engagement to create a 5-star patient experience. But we've achieved a bit of a shift here right now because our new normal mission now is to reignite caregiver engagement to win back every single patient. A study came out by the Alliance of Community Health Plans several months ago that reported 42% of consumers feel uncomfortable going to a hospital for any in-person medical treatment. The study went on to say that 45% don't want to go for urgent care or walk-in clinic. 38% said they would delay scheduling elective procedures, and 27% wouldn't go to a hospital for a diagnostic test. Now, that's the bread and butter for a hospital. As my colleague and friend Bill Wagner at Family Health Center in Louisville said, all COVID all the time is exhausting. It's time to shift the focus back to the patient. So what we want to challenge you to do is to get ready for the next step, and that is to reignite. That amazingly creative author C.S. Lewis said a long time ago, you can't go back and change the beginning, but you can start where you are and change the ending. So I want you to think about what's happened to us in 3 phases. To begin with, all of healthcare was involved in mobilizing its response to the pandemic. And the second stage is to fast track regaining lost ground, except I don't know that anybody's fast tracking it. I think there's been an expectation by most healthcare leaders that the volumes will return to pre-pandemic level. Here's the problem. While there was a pent-up demand and volumes went back, they've leveled off right now. And then the third is to refocus on growth, but that's a ways off right now because we're still into the middle of it. So we want to suggest the focus now should be to reignite winning back every single patient. Now, there's many ways to talk about reignite. It can be regain, revive, refresh, revitalize. I'd like to use the word reset. It's time to reset. And our mission now is to bring 3 capabilities to help you help healthcare regain lost patient volumes and grow. So what I want to talk about is 3 phases of education that will help you and your people reignite, how to reignite community support through an innovative outreach marketing, and thirdly, 3 powerful tools to engage, empower, and inspire. So let's look at 3 phases of education. To begin with, what we want to recommend is to re-energize. We need all hands on deck. In many ways, our frontline caregivers, our leaders are struggling. They're struggling with overwork, overwhelm, stress, burnout, exhaustion from changing PPE all the time. You pick an emotion and they're struggling. In some respects, it's like, if not is, PTSD. So what we want to recommend is a 1-hour, 60-minute dynamic presentation to all caregivers to kick this thing off, to help bring them back and reignite their passion for the patient experience. To do that, we think the agenda needs to be, to begin with, we need to talk to people about resilience, the 8 facets of how to bring back energy to our frontline caregiver heroes. Secondly, we need to teach them the skills of reputation recovery. How can they talk to their families and friends and neighbors about their skepticism and win them over in a way that is persuasive and effective? Thirdly, we need to get a message out about safety. And there's a concept called sentence starters. Sentence starters is an easy way to communicate to patients an important subject in a way they can accept and understand. And fourthly, we need to engage our frontline in joining the force to create a culture of safety outreach. How do we go outside the four walls of our facilities and bring people back? Finally, we need to honor our caregiver heroes, and we've got some exciting ideas to share with you about that. Second educational initiative is to revitalize leadership recommitment. And the challenge now for our leaders is, how do you lead in the new normal, the next normal, or the no normal? Well, what we want to do is offer a program called How to Lead in the New Normal. In other words, to equip your team leaders with timely, relevant, turn on a dime leadership education. There are 4 key competencies leaders need to know to begin with. They need to know how to empathize and support and value and nurture the struggling front line. So education number 1 is caregiver empathy and COVID-19 fatigue. How can we support our front line, hear them out, empathize with them, and then bring them along? Number 2, the key challenge for the next couple of years is going to be never-ending, radical, perpetual change. And to bring that about, we need the front line to buy in. And I'm not so sure managers have ever been taught how to bring the front line along. So we'd like to do a segment called How to Gain a Buy-in from Anybody for Anything. And I can tell you, every time we've taught this program, it's been a revelation, an epiphany for leaders to know there is a way to engage their people. Thirdly, if there's one new leadership skill that is totally relevant for this new era, it's agility. And we've developed a segment called the Agility Advantage. How are you able to turn on a dime? How are you able to adapt to the radically changing environment? And fourthly, and this is so cool, who wouldn't want to learn this? How to influence and persuade and to do it in a way that's easy to understand. So we put this program together. It's a 4-hour educational program, and it's designed for the new leader's role in the new normal. What I want to talk to you now about is phase 3, and that is how to fast track a safe 5-star healthcare experience for everyone. I want to make a point here. Advertising will not bring back people who don't like you or are afraid of you. So what we want to recommend is that we adopt the concept of having safety ambassadors, key individuals who go out into the community and communicate a message that we've got a safe 5-star experience waiting for you, waiting for everyone. And the concept is based, I was so impressed by a 60-minute story about Johns Hopkins Medicine, the sending physicians and others into the community as trusted messengers. Why? Because as Mr. Amin said, because right now people don't trust hospitals and doctors. Not all, but there's way too many who don't. So the concept is, we would like to be involved with you in teaching your brightest and best frontline caregivers how to be safety ambassadors, how to go out and give speeches to churches and business organizations and service clubs and associations of all kind, either live or via Zoom. Now, before this pandemic, we even knew about Zoom, but now we've all become Zoom competent, so to speak. So we want to launch this Safety Ambassador Initiative with you. So there you have 3 educational initiatives that, number 1, how to win back every single patient, engage all caregivers in helping them come back on track. Number 2, how to lead in the new normal. And number 3, a train the trainer, train the facilitator program for dynamic, positive frontline leaders and board members and other individuals to go out and outreach and deliver a message. We've got a safe 5-star experience waiting for you.